So any of these kinds of laboratory tests has occasional false positives or false negatives. None of them is perfect, but generally a good test will have a very low rate of false positives and false negatives, maybe one or a few percent at most. And
Okay.
the PCR-based tests tend to be they can be designed to be very specific, so they have very few false positives. If you have influenza virus and you're shedding it into your nose, it's extremely unlikely that the influenza virus genetic material will cause the PCR test to be positive for the coronavirus. Each of these PCR tests can be designed for a very specific type of virus. The antibody tests tend to be a little bit less specific. For example, a close relative of SARS coronavirus like MERS or these human respiratory viruses, if the test is not designed optimally, there may be some cross reaction. So if you're immune to a human respiratory coronavirus from 10 or 20 years ago, um, it's a little bit harder to design the new SARS tests such that that immunity won't cross react. But usually that can be done very effectively